Good morning all. The topic of presentation is treatment outcomes of Plana vitrectomy, hyaloidotomy, zonelectomy and iridotomy in malignant glaucoma. Malignant glaucoma is defined as uniformly flat anterior chamber with a patent PI and it's considered as a refractory entity. The aim of the study is to study the efficacy and safety of Plana vitrectomy, hyaloidotomy, zonelectomy and iridotomy in malignant glaucoma in Indian eyes in a tertiary care center. The medical records of malignant glaucoma patients between December 2018 and August 2022 were collected. The patient who underwent the surgery were included in the study, and the IOP, number of anti-glaucoma medication and presentation and follow-up were recorded. This is a surgical procedure where the Plana vitrectomy is done with 5,000 cut rate and 650 aspiration rate. Then the hyaloidotomy is done, and finally the sonolectomy and iridotomy is done to make the eye unicameral. This is a procedure. The anatomical success was defined as deepening of the anterior center anterior chamber. Complete success is defined as IOP less than 21 without any anti-glaucoma medication. Qualified success is defined as IOP less than 21 with anti-glaucoma medication, and failure was defined as flat anterior chamber or IOP more than 21 with anti-glaucoma medication, or those patients requiring a second procedure. Coming to the result, 36 eyes of 30 patients were included. Mean age was 70 plus or minus 10 years. 35 eyes were pseudophakic. The cataract surgery was the most common primary procedure in 66.7%. B-scan was done in all the patients and none of them had any suprachoroidal or CDs. And this is the 3 patients had aqueous pockets on B-scan. There was statistically significant improvement in the mean visual acuity post-procedure with a p-value of 0.001. Duration between the primary procedure and malignant glaucoma was mean duration 18.2 days, and the mean duration of development of malignant glaucoma and surgery was 2.61 days. 13 patients were operated on the same day. There was statistically significant reduction in IOP in each visit with a p-value of 0.001. IV mannitol was given in 17 patients at the presentation and 22 patients 30 minutes before procedure. There was reduction in anti-glaucoma medication statistically significant with follow-up follow-up visit with a p-value of less than 0.001. Atropine 1% ointment was continued 1 month post-operatively, and at 6 months follow-up, 19 patients were not on any anti-glaucoma medication. 8.3%, that is 3 out of 36 eyes failed at 6 months. 44.4%, that is 16 out of 36 eyes achieved complete success. 17 out of 36 eyes, that is 47.22% achieved qualified success, and a total success of 91.6% was achieved. This is the Kaplan-Meier analysis curve for complete success and the qualified success. Coming to the discussion, mean IOP at presentation was 37.39 and final follow-up was 13.79. There was statistically significant reduction, and the reduction of IOP was comparable to the previous studies by Raj et al. And Zarnowski et al. Mean number of anti-glaucoma medication at presentation was 2.64 and at final follow-up was 0.38, and there was more reduction in anti-glaucoma medication compared to the previous studies by Raj et al. Balakandru et al. There was 97.22% achieved anatomical success and 91.6% achieved total success, and none of the patient had any relapse. The total vitrectomy with vitreous-based shaving that is done in this particular surgery prevents a secondary blockage of the tunnel that is already created, and it prevents any recurrences. There are various previous studies, but they analyze different modalities of surgeries. This is one of the studies with a larger number of eyes, which analyzed this single surgery and found out that there is no relapse in these cases. This is preoperative. This is one patient, 83-year-old patient, combined surgery, and patient IOP was 63 at the time of presentation, and patient was having a flat anterior chamber. And this is a post-operatively showing deepening of the anterior chamber. IOP was within normal limit, and patient was not on any anti-glaucoma medication. This is a bilateral case of malignant glaucoma post SICS, and both eyes underwent this surgery. And right eye AC is deep with 14 is the IOP, and patient is on single anti-glaucoma medication. Left eye AC is deep with IOP 18, and patient is not on any anti-glaucoma medication. So what this study adds to the previous studies as larger sample size in comparison to the previous studies. It exclusively assessed this particular surgery and found out that the success rate is around 91.6%. Anatomical success of 97.22% is seen, and none of the patient had any recurrences, as there is a reversal of the aqueous misdirection due to the tunnel effect. In added to that, the total vitrectomy and vitreous-based shaving done in the surgery prevents the secondary blockage of the tunnel that is already created. To conclude, even though malignant glaucoma is considered as a refractory entity, Plana vitrectomy, hyaloidotomy, zonelectomy and iridotomy surgery can achieve favorable outcome with reduced chances of recurrence. Thank you.
Thank you. Do you have any questions?
Yeah, thank you for the nice presentation. I mean, just one question I would like to ask. How many days before you took up for a vitrectomy, they were medically managed? And
How
what
many
kind of, and what kind of medical management or any other procedure was taken up before the pars plana?
Yes, sir. They were managed based on the IUP. First, we will start on with patients were given mannitol if the IUP is more than like 40. And then many patients, we have taken only patients post PI. So if the patient only underwent cataract surgery, we did a YAC PI, then again reassess the patient and took the patient. Then only malignant diagnosis of malignant glaucoma was confirmed. So those patients who underwent combined surgery, if they present with the malignant glaucoma, they were taken on some of them were taken on the same day. And that is the procedure.
Any of the patients had undergone a YAG hyaloidotomy?
This patient, no, sir. We excluded those patients.
Okay, right.
We took only those patients who underwent YAG PI and after that underwent the surgery, sir.